Here's a shocking fact. Salt Lake County may be facing its first measles case in years, but the patient at the center of it all is refusing to cooperate. This isn't just a personal health issue. It's a public safety concern that could put countless others at risk. But here's where it gets even more complicated. Without the patient's cooperation, health officials are left scrambling to confirm the case and trace potential contacts. On Wednesday, Salt Lake County health officials revealed they'd identified a probable measles case, marking a significant development amid the ongoing national outbreak. The Salt Lake County Health Department explained in a statement that they were notified of the case late Monday and spent Tuesday trying to reach the patient for a thorough investigation. And this is the part most people miss. Despite their efforts, the patient has declined testing and further involvement, leaving officials unable to confirm the illness or conduct proper contact tracing. While we can't technically confirm the case without the patient's cooperation, we're not here to judge. We're here to protect our community, Adams emphasized. But here's where it gets controversial. Some may question the balance between individual privacy and public health safety. Should there be stricter measures to ensure cooperation in cases like this? We'd love to hear your thoughts in the comments. To verify the legitimacy of a public health worker, officials advise checking if their emails come from a .gov address, such as @saltlakecounty.gov. If contacted by phone, you can request they send an email from their verified account or call the Salt Lake County Health Department directly at 385-468-4100. Measles is incredibly contagious, with a 90% infection rate for those exposed who aren't immune. The virus can linger in the air for up to 2 hours after an infected person leaves, making it a silent but dangerous threat. Vaccination remains the best defense. 2 doses of the MMR vaccine are over 97% effective in preventing infection. Even in the rare cases where vaccinated individuals contract measles, symptoms are milder, and the risk of spreading the virus is significantly lower. Unvaccinated individuals, especially young children and those with weakened immune systems, face severe complications like pneumonia and encephalitis. Symptoms typically appear 7 to 14 days after exposure, starting with fever, cough, runny nose, and red eyes, followed by tiny white spots in the mouth and a characteristic rash that spreads from the face downward. Health officials recommend the following vaccination guidelines. Children, 2 doses, one at 12 to 15 months and another at 4 to 6 years. Adults born before 1957, likely immune due to prior exposure. Vaccination usually unnecessary. Adults vaccinated before 1968 need a second dose due to the earlier vaccine's lower efficacy. Adults vaccinated in 1968 or later considered fully protected, though high-risk groups, example, healthcare workers, should ensure 2 doses. If you're unsure about your vaccination status, check your records via the Docket app or consult your doctor. There's no harm in getting an extra dose if you're uncertain. County officials advised. Vaccines are available at pharmacies, doctors' offices, and SLCO HD clinics. https://www.saltlakecounty.gov. Call 385-468-SHOT to schedule an appointment. With measles cases on the rise, should vaccination requirements be stricter, especially for public health safety? Let us know your stance in the comments. If you suspect measles exposure, contact your healthcare provider immediately. They can arrange a safe evaluation to protect others. Your cooperation could be the difference between containment and an outbreak. Our work depends on your support. Donate here. UtahNewsDispatch.com/donatepm. This story is licensed under CC by NCND 4.0. Republish with attribution and a link to our site. For photo usage guidelines, visit here. UtahNewsDispatch.com/republishing guidelines.